If someone told me years ago that I will get a nursing job in Canada from Nigeria, I would have laughed. But yes, it happened. And today I am breaking it down exactly how I did it, step by step, so that you can do it too. My name is Joan Osas. Welcome to my channel. I am an internationally educated nurse from Nigeria, now living and working in Canada. If you are planning to work as a nurse in Canada, this video will help you to understand the real process without confusion. So let's get into my journey from Nigeria on how I got hired by Abata Health Services. Before I applied, I already had my nursing education and work experience in Nigeria. I had my license and I knew I wanted to grow my career internationally. The Canada process may look complicated, the step might feel long, and the information online may be overwhelming. But I want you to start somewhere, just like the way I started somewhere. Canada has 10 provinces and 3 territories. Browse through each of their government's websites and their largest healthcare employer career section. You might find something. That is how I found my opportunity. And recently, Abata Health Services opened its international recruitment portal for international health care workers, including nurses. Abata Health Service is one of the largest healthcare employer in Canada, and they are known for recruiting internationally, and they offer immigration support and provide growth opportunity. So there are some documents you will need before applying. So before I applied, I make sure that my documents are ready. You understand? And this is what I prepared. I updated my resume to Canadian format. I had my valid nursing license with me. I had my international passport, valid international passport, my education transcript, proof of English. I had the basic I have the basic for further assessment and interview. You understand? I applied directly on the Abata Health Service career website. I will drop the link in the comment section later. In my resume, I highlighted my training and my experience in assessment, medication administration, wound care, documentation, emergency response, patient communication. Because Abata Health Service wants to see that your skills matches Canadian practice. You understand? Break your process down for them. So after submitting my application, I got an email that stated I was successful after initial assessment, and I was asked to start my evaluation with NAS. But now there are organizations that evaluate credentials for Abata, like the World Education Services, ISEC, and so on. So when the report is ready, they will send it to CRNA, and I got my conditional license and authorization to write NCLEX. Then I was scheduled for a virtual interview. The interview was about 45 minutes and focused on behavioral questions, scenario, my nursing experience, how I handle emergency, communication skills, why I wanted to work in Canada, and my availability for immigration. They wanted to know if I could adapt, learn, and work in a new environment, and most importantly, in rural area. Three things that helped me during the interview were: one, clear communication. Even with my assets, I spoke slowly, confidently, and clearly. Number two, evidence of continuous learning. I mentioned my online courses, certificate training I've done. Number three, professional attitude. I stay positive. I show eagerness to learn Canadian standard. Few weeks after the interview, I received a conditional job offer. With the job offer, I began the immigration process and the NCLEX and prepare for NCLEX exam. Abata Health Services, they provided guidance throughout the processes. So I want you to know that it's a long process. You have to be patient. And one biggest lesson I learned was that Canada reward preparation. You have to be prepared. There is no employer that you reach out to that will not ask you these basic things: your updated CV, your international passport, your English proficiency tests report. They will always ask you. So I want you to have this positive mindset that you can achieve whatsoever you want to achieve. So that is my story on how I got a job with Abata Health Services in Canada from Nigeria.